Welcome to our 8th Lighthouse webinar. This webinar is in a series of webinars that we've been putting out on the Lighthouse. And this is going to be on the public as partners, unlocking the potential of citizen science in disease prevention and control. So we have a really, really fantastic afternoon set up for you. My name's John Kinsman. I'm the head of the Social and Behaviour Science group at ECDC. And we are running the Lighthouse for you to bring in people to talk, to share, to give you the opportunity to network and get to know new things about social and behavioral science in the prevention of infectious diseases. So we've got two fantastic speakers with us today. We've got Anne-Sophie Gresle from Barcelona Institute for Global Health, and we've got Frédéric Bartumius from the organization called Mosquito Alert. And they're going to be telling us about the different elements that they've been working on in citizen science. They will give their presentations, and then we're going to have an open discussion. And if you have questions or comments, please put them in the chat. That's how we're going to know how to address things during the discussion. And please also note that after the event is over, we're going to continue the discussion on the Lighthouse platform on a dedicated forum thread. The Lighthouse is, as I said, it's an online platform for people who are involved in prevention of infectious diseases and who have a social and behavioral science interest. So I'm going to hand over now to Alexis, who is the Director of Policy and Research at the European Health Management Association. And Alexis is going to moderate this session and take you through it. So Alexis, good afternoon and a very warm welcome to you and everybody else. Let's have a good time.
Thank you so much, John, and good afternoon, everyone. Thank you for taking the time out of your busy schedule to join us for this webinar. We're really glad to have you. So as John mentioned, this meeting will be recorded and will be uploaded to the EVA platform and also onto our open social platform once it's launched. And questions are certainly encouraged. So feel free at any time to put your questions in the chat. And if there are questions that were asked by others that you really liked and you want to be prioritized, just give a like or a thumbs up to those, and we'll prioritize those first. And if your question is directed towards one speaker in particular, please also make sure to mention that. The way this webinar is going to play out is first, we will kick it off with a couple of online polling questions just to get you all thinking and engaged. Then we'll have presentations from our two guest speakers. And then after the presentations, we'll go directly into a moderated discussion where we'll tackle the questions that you've put in the chat and have a nice dialogue on the topic of today. And then we'll close at the end of the hour. So with that, let's kick it off with some Slido questions just to get you warmed up to today's topic. You can either use your mobile phone or you can also access Slido on your laptop. The QR code is there on the screen. So once you're logged in, you should see questions come up. The first question come up. I'll give you just a couple of minutes to answer these. The first question is, would you personally be willing to participate in a citizen science initiative for infectious disease prevention and control? So this would be things like reporting symptoms or tracking mosquitoes via an app. So take a moment, give your answer. And of course, our speakers will probably also refer to these questions in their presentations or during the discussion. So keep that in mind. Okay, so about half of you have responded to this first question, and it looks like it's about 50-50 here, where half are saying yes, I would definitely. And if it's simple and secure, or yes, definitely. So most everybody would participate either once being reassured that it was secure, or no matter what, enthusiastically, yes. And considering the audience of today's webinar and your interests, this makes sense. So let's move on to the second question, just to see if we can compare and contrast. So now thinking about your friends and family, do you think that they would be willing to participate in a citizen science initiative? So they may not be working in public health or be interested in public health like you are. Do you think that they would be open to it? Take a second to think about it and mark your answer. Okay. Thanks all for giving your responses. We've got about half of you all answering, and it looks like for sure that about 44% thinks that their friends and family would participate as long as they were reassured that it was simple and secure. And then there's a pretty fair percentage, about a third of you saying you're not sure, which is fair, and even some probably nots. And we'll come to understand this throughout the conversation today, but really helpful to understand your perspective on these two questions. We'll have one more Slido question at the end of the presentation, so keep your mobile phone handy to answer the third question. Okay, so now we're going to dive right into our presentations, and our first speaker will be Anne-Sophie Gresle. She's the Public and Patient Involvement Manager at the Barcelona Institute for Global Health. She promotes active participation of citizens as well as patients and caregivers in all phases of health research and has led projects bringing science and society closer together. She's also a member of the Patient Experience Observatory at Hospital Clinic Barcelona, which works to integrate patient perspectives into healthcare strategies and practices. So I'll turn it over to you, Anne-Sophie.
Well, thank you very much. Good afternoon, everybody. I'm very happy to be here with you today. It's really a privilege to share this important topic that I really believe have the potential to transform health research. So I will talk about patient and public involvement in health research, and the introduction on myself has been already done, so I won't spend more time explaining. So over the next minute, we will delve into what public and patient involvement, so PPI, truly means, why it matters, and how it can be effectively implemented throughout the research cycle. So if you can go to the next slide, please. So yeah, even if you already have had an introduction, a bit of who I am and the work that we do and where I am located. So here is also another slide, so to go through it again. So I work at the Barcelona Institute for Global Health Research, which is one of the two research institutes linked to the Hospital Clinic Barcelona, which is a university hospital. And our work focuses on both participation in healthcare improvement project, but also participation of civil society at large in research projects. So we think the model is interesting, and in a university hospital as well, the line between health research and healthcare is very thin. So next slide, please. So here are the different dimensions of participation, and it's to show you that it's not a monolithic concept and it can manifest in several dimensions. So from shared decision-making at the individual level to a more collective level, for example, health policies or influencing the governance of healthcare institutions. So the spectrum of involvement is pretty wide, but today we will focus on participation within health research. Next slide, please. So this slide shows one of the many ladder of participation that you can find in the literature. And it's to show that participation really have to go beyond simply informing or consulting, which is usually also not considered as participation. So participation involves a deeper, more collaborative engagement. And we can reach really its ultimate level. That would be, for example, patient-led research setting. And also, we have to distinguish between genuine participation and what is sometimes referred to as tokenism, when patient involvement is only symbolic or superficial. So you would invite patients to your meetings, you would take a picture, for example, but you don't really create the space for them to truly participate and have an impact at decision-making level. So that's important to have that in mind. If we do participatory research, it's because we really want to create those spaces and to see changes happening. So next slide, please. So I was saying now we will focus more precisely on participation within the health research landscape and why that's really important. So you can change the slide. So I wanted to mention this book because for me it's a very interesting one, which was the book Rebel Health by Susanna Fox. And it touched upon in the first chapter around the history of patient movement. And sometimes, at least in my environment, I would say this is something that is usually overlooked. So we usually believe that patient has not been quite instrumental in achieving like different important changes in the health system. But in fact, when we read the book, we see that it's not the case. And so the author, Susanna, she described the immense power of patient movement and how historically patient advocacy groups have been instrumental in driving research agenda, for example, raising awareness and demanding better treatments and care. So she shows there how their collective voice and organized efforts have demonstrated a profound impact on scientific progress. So patient community, she explained, are often incubators of grassroots innovation. They are on the front lines, experiencing the challenges and identifying the solution that might not be apparent to researchers working in isolation. So she says that by harnessing this energy and expertise, we can unlock new avenues for discovery and accelerate the translation, for example, of research finding into tangible benefit for patients. So this collaborative spirit is really about transforming patient from passive recipient of care or subject in health research to really active agent of change in the research ecosystem. Next slide, please. So what do we mean when we talk about participation in health research? And I like to cite, so this is not a new article, but for me, this is a very classical one published some years ago already in the Social Sciences and Medicine journal. So they asked the question, so if all research involves participation, what makes research really participatory? And basically the authors say that it's not just in what is done, but how, by whom, and for whom the research is conceptualized and conducted. It's about where the power is located throughout the entire research process. And also participatory research as its core is also about research for action. So research that is directly informed by and responsive to the needs of the community it serves. Next slide, please. So this one is to show that you will probably encounter various terminologies in the field, and for example, in the title as well, we mentioned citizen science, but there are other terms like, well, I use the public engagement and involvement, community-based participatory research, etc. So these terms can be confusing, but I think that is important and to show what they have in common. And for me, is that they all point towards a shared goal, which is a more inclusive and collaborative approach to research and innovation as well. So next slide, please. So yeah, I was saying that for me, I use the term and also the frameworks that were developed in the public and patient involvement field. And I use the definition from the National Institute of Health Research. So basically, they define public involvement as the active involvement of the public, so including patient, potential patient, caregivers, and people who use health and social care services in the activities, organization, and governments of research projects. So it's really about conducting the research with or by members of the public rather than merely for or about them. And they do the distinction as well with public engagement, which would only focus on providing and disseminating information about the research. And again, here, what we want is really to change this paradigm and have people participating really as active agents within our projects. So next slide, please. So the active involvement is grounded in core principles that those affected by research should have a say in how it's conducted. It's about shifting from a top-down model to a truly collaborative partnership. So this principle acknowledges that those directly impacted by health condition and healthcare system possess invaluable lived experiences and insights that researchers, no matter how expert they are, of course, cannot replicate. Next slide, please. So why PPI is important? And I like to show this series of articles that were published in the Lancet some years ago, and that highlight the critical need to increase the value and reduce waste in health research. It showed a mismatch, as you can see on the slide, between what patient priorities are and what the research is currently doing. And I believe that PPI is a strong mechanism to reduce this mismatch. So when patient and public are involved from the outset, research questions are more likely to be relevant to real-world needs, study design are more practical, and outcomes are more meaningful for those they are intended to benefit. So beyond the practical benefit, there are also strong ethical and democratic and editorial arguments. So ethically, of course, it is about respecting the autonomy and rights of individuals to have a say in research that affects them. Democratically, it aligns with the broader societal trends towards greater public accountability and involvement in decision-making processes. And also PPI help us respond to complex problems by incorporating diverse perspectives, identifying again real and unmet needs, and ultimately also improving the design and quality of research. And also the influence of funding bodies and ethics committee, for instance, from the UK, increasingly also mandates for PPI, recognizing its crucial role in ensuring research quality and public benefits. Next slide, please. So a quick note as well to say that this commitment is also reflected in broader scientific policy at European level. So in the past, it was the responsible research and innovation scientific policy. Now it's called the open science. And within open science, we have the citizen science component that is here. So also Europe is really putting emphasis on this type of practices. So please, next slide. So now we will explore when and how PPI can happen. So this is the research cycle, and PPI should not be considered as a one-off event, but as a continuous process that ideally would span the entire research cycle, from the initial idea generation to the final dissemination of results. So please, next slide. So when participation can happen, well, you see, it can happen at different phases of the research project. And for the sake of time, I will not go through in details of all the phases, but go through really a quick example in the next slide. So please, next slide. One example that I like to mention is for the first phase, so the identification and prioritization of research question. Next slide, please. And it's from the James Lind Alliance, again in the UK. And it's a really powerful example Yeah, sorry, if you can go back to to that one, thanks. So basically what they do partnerships, setting priorities, and they bring together patient, caregivers, and healthcare professionals to identify and prioritize unanswered questions about a specific condition. It's all open. You can go to their website and you will find all the information. And for many, many different diseases, you will find the top 10 priorities and even more that they've been working together through a very well-established protocol, research protocol. And it's all there. So I invite you to consult their website. So as we move through the research cycle, and you can move to the next slide, the opportunity for involvement continue. So patient can advise on the appropriateness of protocols and the methods. They can support recruitment. They can also participate in the project governance through a patient advisory committee, for example. They can review informed consent to ensure that they are clear, understandable, and then can even collaborate in data collection. So next slide, please. And I think a fantastic example is this project is Mosquito Alert. So it's a truly citizen science project where citizens have been actively participating in the data collection on mosquito population. So directly contribute to public health surveillance and research. And the next presentation is actually about this project. So I will not tell you more, and the next presenters will explain you much more in details this project. And if you go to the next slide, I wanted to show you these great resources, which is the online platform for citizen science project from the European Association of Citizen Science. It's a hub, online hub of various citizen science initiatives. So you can go there and filter with many different variables to find projects that could be of your interest. Next slide, please. So for the dissemination phase, it's equally crucial in PPI, and it's not enough to conduct excellent research. The findings have to reach the people who can benefit from them in understandable and accessible way. So patients are invaluable partners in this process as well. So I will quickly mention 2-3 things in the dissemination phase, if you can go to the next slide. So for example, it's one method that we've been using in the past project, a scientific cafe. So it was a collaboration between a museum, our research center in the context of this project. And basically, the objective is to create a relaxed environment for researchers and the public to discuss research findings, fostering dialogue and mutual understanding. So really to go beyond the traditional academic presentation to a more accessible and interactive format. So please, next slide. And as I was saying, so patient can collaborate with researcher to present the finding, and they can participate in publication and also prepare summaries that are tailored for the public, the general public. And you see on screen, for example, this is a journal that have a specific question where you can find a plain language summary for each of their scientific articles. So they really try to make sure that the message will reach a broader audience. And finally, I also wanted to mention, for example, important journals such as the BMJ that is now asking in the publication process about the PPI elements throughout the research project and how the patients were involved. And they also have patients working as experts during the peer review process. So last slide, please. I would like to finish by using the motto from the Mayo Clinic. So the think big, start small and move fast. So to envision a more inclusive, impactful research paradigm, to start small with a pilot project and move fast to iterate and expand based on early successes and learning. So finally, I would like to encourage each of you to consider how you can integrate PPI into your own work, whether you are a researcher, healthcare professional, policymaker, member of the public, to continue building bridges between science and society, ensuring that health research truly serves the needs of the people it aims to help. So thank you very much for your attention. It was challenging to go through the concept of participatory research in a small amount of time, and I hope I stick to the time that was allocated to my presentation, and I'm happy to take the question at the end. Thank you very much.
Thank you so much, Dr. Gresle, for your presentation. So much to unpack. You really covered a lot in a short amount of time, and I know I appreciate that very much. I learned a lot. I heard some really interesting points, moving from passive recipients to active agents of change. And it's all about what you're doing, how you're doing it, who is doing it, and for whom. And thanks also for sharing so many resources, because through this, we can take these resources and these will be helpful in applying these methods in our own work, in our own practice. And if you're members of the Lighthouse, we've also of these curated resources from Anne-Sophie and share them on the Lighthouse platform, so you can also access them there. Great. So with that, I will move on to our second presenter, Dr. Frederick Bartimeus. He is the co-director of Mosquito Alert, a citizen science platform and early warning system that detects invasive mosquito vectors, monitors arboviral transmission risks, and strengthens preparedness across the EU. He is also a research professor with the Barcelona Institute for Research and Advanced Studies, based at the Center for Advanced Studies of Blanes and the Center for Ecological Research and Forestry Applications. His work focuses on computational and theoretical ecology, combining quantitative research, participatory science, and digital innovation to address challenges in disease ecology and public health. So with that, the floor is yours.
Thank you. Thank you, Alexis. Welcome, everybody. Thanks for taking the time to be in this webinar. So let's start. So next slide, please. Okay, I'm going to show you a bit of what we have been doing in the last 10 years. This is just a recent manuscript that came out last month, where we explain our experiences in integrating different methodologies of mosquito vector surveillance. We are in the context of mosquito-borne diseases using digital tools. So basically, we have incorporated a new system, which is a participatory system, which entails an app, a cell phone app, so that citizens can collect data related to mosquitoes, but very, very specifically to vector mosquitoes. So these would be more very similar to other, let's say, projects that are collecting nature information about plants or butterflies, birds. But in this case, the trick or the challenge is that we are tracing disease vectors, mosquitoes that are able to transmit diseases, and therefore the whole communication and the whole spirit of the project needs to be public health oriented and not so much biodiversity sort of, or entomological fauna data collection. So for the last 20 years in Spain, we have been tracing these vectors, mainly the tiger mosquito. Aedes albopictus is one of the big vectors all around Europe currently. And we have been able to show that we are able to incorporate at least 30% more of the first detections of these mosquitoes through this system. We also have other species of mosquitoes that were reported for the first time in Spain thanks to citizens. This is kind of obvious. So if you inform people about the presence of these mosquitoes and ask people to report information, you will really get information in areas, in places where you are not performing the surveillance. This surveillance is very costly, entails going to the field, put traps, identify the mosquitoes, and then once you identify this vector, and that's the nice thing of this project, you activate a public health response for a given municipality where this vector is observed. So the discoveries of the vectors themselves has a consequence for public health. Next slide, please. How I like to talk about this mosquito alert system. Mosquito alert is the app, but it's not only an app. It's a digital system that entails, of course, citizen. The app is the tool, the device that connects researchers and all different sorts of communities that we are working on this data with the citizen. That's the system that allows us to interact with them. But of course, this is a whole ecosystem. And there's the data collection system, then there's the data processing system, which is a very technological system. And then we have a data validation system, which entails a network of entomologists. So we are expanding this project across all Europe, and we have a network of 80 entomologists that are validating these pictures and informing the citizens about what they are collecting. And now we also have incorporated artificial intelligence, because that will fasten the process of validating the images, that the information that the citizens are reporting. And of course, this data is then used by academics. This is all open science data. Citizens can also use it. We also have a school program where they are playing with the data that themselves are generating. And we hope, and we're generating outputs from this data that can be useful for public health stakeholders. So when I say an ecosystem, is an ecosystem of infrastructure, technological, there's apps, there's servers, there's data pipelines, but it's also an ecosystem of communities. And here we're talking about the citizens community, the public health stakeholders and public health responders, and the academics. Next slide. With this data, we can generate different types of outputs and information. And this is what we have been working on and progressing through these 10 years. First of all, whether this data is usable at all, no? Given the biases that this data is coming from. No? Citizens report whenever they want and whenever they can, and if they want and if they can. But yeah, there's science, and we can deal with this data to generate outputs that are useful and allow us to help on decision making very often. So these are some of the tools. We have devised an early warning system. So these images are now super fastly identified, and then we can contact national contact points that we have in the different countries, or even at the different province levels, that are interested in knowing whether this vector is in the territory or not. We also are able to generate models out of this data that tells us about the activity, the suitability of having the presence of one of these vectors all across Europe. We also work on bites information. Citizens are not only reporting images of mosquitoes, but they can also report information about when and where they are bitten, and also information about breeding sites that we'll talk a bit about later. And now, next step, and this is why we are here, we are more and more interested into generating feedbacks to these participants to promote preventive habits and generate co-responsibility in public health management. So make them really much more aware about what they can do to help to minimize the risk of the presence of these vectors, and therefore the risk of the presence of the diseases that these vectors are transmitting, that I have not explained, but these diseases are dengue, chikungunya, yellow fever in one case, or it could be other types of diseases like West Nile virus. Okay, so these are all arboviral diseases. Next slide. So here today, I only will have time to explain you a couple of ideas, and I'm going to be focused on the idea of the early warning system rather than on the modeling and the types of models that we can generate with this data. Okay, basically, the main concept is that this information from citizens is validated by the conjunction of an expert network of entomologists, and also an artificial intelligence system that has been trained specifically with pictures from citizens. These are very hard. Let's say for an artificial intelligence, it's hard to discriminate among the species because the images are not high quality images. They are done by normal citizen. There's fingers in it. The mosquito is small, even though we are able to really start to discriminate species, so which is very good news for us. You can see the map of Europe, and again, as I was telling you, whenever we see an image that is suspicious to be with a given reliability a species, we are automatically informing stakeholders that are in our lists of people that needs to be aware. We are also reporting to ECDC this information and to some national contact points. Next slide. I'm going to explain you a very nice example in Spain. So the tiger mosquito in Spain is spreading from the north to the south on the east coast, basically. So we would never have been sampling or surveilling in the northwest of Spain, in Galicia, up north in Portugal, okay? But all of a sudden, the 6th of August of last year, 2024, we observed an image of a tiger mosquito in the northwest. Very fastly, we coordinate with the network of people in that province in Galicia that is having a network of vector surveillance so that they could go to the field and confirm very fast, let's say 2 days after, that that image was really of a real specimen of tiger mosquito. Then, in conjunction with them, we generate a press release, and then we ask for more and more participation of the local citizen in that area for us to be really very fastly be able to assess the you know how was already the spreading, you know, what because one specimen is not enough. You need to really see, you know, if the species appears in the local neighborhood, so how fast has been spreading without us not knowing it. In the right hand side, we can show you here participation on that community for 2023, 2024, 2025 this year, and the arrow is signaling today, let's say. But you could see in 2024 that we have a lot of activity from August to November because of that specific communication campaign that we did with them. We were able to discover tiger mosquitoes in 11 new municipalities. We get 950 images of tiger mosquitoes in that area, and thousands of images of other mosquitoes, of course, and thousands of participants active in the area. Next slide, please. I'm gonna explain now another case of early warning. I don't know if you remember, but we were having a big flooding disaster precisely in October, 29th of October last year, with 227 deaths. It was a terrible, flooding. You will see now in the images. But the story here is that if you have such a system prepared beforehand when you have one of these catastrophes, this is something that the Ministry of Public Health system can all of a sudden use and exploit in moments of chaos where there's no normal communication, no radios, no TV, nothing was working except the network of cell phones. So cell phone companies were the first ones in recovering the possibility of communication. And at that time, the Ministry of Health contacted us, and we plan an action together. Again, mosquito alert is coming from academics, but we are always collaborating and trying to make things together with administrations, with public administrations taking care of health of citizens. Next slide. So this is just an image for you to figure out that happened in hours, literally hours, 4 or 5 hours. So everything was very complicated. But we were able to organize a specific committee and we were able to deploy and communicate the app. Not really, we were not really interested in the actual flooding event and moment, but you know that this water is stagnant and staying still for many days. Still, it was relatively hot. We were in with warm temperatures, and we were projecting the proliferation of a lot of mosquitoes and related problems, either health problems or nuisance problems, with all potential species of mosquitoes popping up in these flooded areas. So we activate a plan. Next slide. And together with the local, the government, the regional government of Valencia, we asked the citizens to report. And as we were not thinking that making images of mosquitoes at that time was something useful, we focused a lot on the bites reporting. So we really wanted to make a heat map of potential nuisance. Even if they were not mosquitoes, we would be okay. Where people was mostly bitten in the months or in the weeks following the flooding. The communication was fluid, it worked well. Next slide. So this is an example of the activity that we gain in Spain. That special bump is very much concentrated in the areas of the flooding. We were able to use like formal channels of communication, WhatsApp groups, also putting flyers in specific neighborhoods. So we collect a lot of data, but what happened, luckily, is that winter came all of a sudden. So by mid-November, just 1 month after the flooding, temperatures dropped down, and therefore the activity of mosquitoes really went down. So we didn't have to do anything else. So we were, preparing an activation plan at different stage levels. But as we were seeing that nothing was really worrying or concerning, we just stopped the plan and nothing happens. Everything was fine. We didn't activate other sorts of stages of action. Then next
Frederick,
slide. Yes.
Excuse me for 1 second. Sorry. I just want to make sure we have some time for Q&A,
Yes,
and I
sure.
see we're getting close to the end of the webinar. So I was wondering if you could maybe wrap up towards the end of your presentation, please.
Perfect, no problem. Next slide. So what we are now, and that's the main concept that I want to share with you, is that rather than just collecting information and make people aware of things, we are thinking that we are also missing opportunities with the digital tools to generate more activation and generate more preparedness and produce behavioral changes in the citizen related to the mosquito-borne disease concepts. That means that we can improve the way we communicate with them, and we can generate different types of tools that can help us to be more intimate, related to society, to citizens that are motivated to participate with us, to improve and minimize the risk of these mosquito-borne diseases. And next slides that we're going to run very fast. Those are changes that we are trying to introduce now in the new system. We want to give them feedback of the local estimates of mosquito abundances, so they have sort of a weather mosquito index, so citizens can tell whether this week there's going to be a lot of mosquitoes or not, and they can prepare themselves for that. Next slide. We also want to generate more active search by participants about mosquito breeding sites at their households or gardens or even in public spaces. And we can help them to identify them with artificial intelligence. Next slide. And also we can ask them questions about what are they doing to self-protect and reduce the disease burden or the mosquito burden nearby them. No, what is their actions that they are taking, or when sometimes we can even promote those actions at specific times. And we want to do that in a very high-tech format. Next slide, and that's the last slide. Sorry, no, the next one. This is the mosquito weather index. So it's using geofencing. So geofencing is a technique where if the participant allows us to share her or his GPS, we can generate specific information at specific moments of time and locations. And that's the future of how we want to prepare this tool for them to be able to protect themselves or have very quick information from where and when are the mosquitoes of concern. And with that, I just close my conversation because I prefer to have discussions with you rather than keep on talking. Thank you very much.
Thank you very much, Dr. Bartimeus, and really fascinating and impactful work. And it's great to have your concrete application of participatory research to complement Anne-Sophie's presentation. So I really appreciate that. And I heard so many new things and learned so much in your presentation, understanding the ecosystem of communities and really working towards co-responsibility in public health management. So thank you for that. We do have one last Slido question for our participants. Just to hear from you in terms of, now that you've listened to these two presentations, we want to hear from you in terms of what you think is the most effective way to promote community participation in citizen science activities. So take out your mobile phone again and access our poll. And we just want to have a couple words. You don't need to write an essay, but maybe some thoughts from you. So I'll give you a few seconds to share your thoughts. And we can keep this up on the screen as it populates, but in the interest of time, I'll go to one of the questions that I am very interested in hearing an answer to. This was posed earlier by John, and I think is best for Anne-Sophie, but could be answered by both. In terms of remuneration of patients, so because the professionals are paid, should the patients be paid? A participant chimed in on this and said that this was a really big issue in the UK and that they have a policy about this. Do you care to speak a little bit about that, Anne-Sophie?
Yes, sure. And I will respond, of course, from my own experience and what I see in my own context. So vision is limited. I don't have like a complete picture of what is happening out there, but I'm happy to see that there is a discussion, at least in the UK, and that you have institutional policy in the UK that regulates, in terms of financial compensation, the public participation. We don't have that, at least in my institutions at the moment. So we believe it's right to remunerate the patient with who we work. Of course, maybe it's difficult to give like one size fits all answers because it depends on the project, and maybe Frederick's vision will be a bit different because the nature of his project is quite different, and he engaged with a very large community and in a different way. So he might have a different answer, but for the project that we do, for example, here and with our patients, so in our hospital setting, whenever we can, at least we try to cover, of course, the fee for transportation and food. So at least it does not cost them anything to participate in our project. And when the level of engagement is higher, so for example, patient advisory committees, so when they have to really work and dedicate more hours to the project, so act somehow as consultant from their own expertise, whenever we have the resources for it, we do have a specific budget for that. Yeah.
Thanks for providing your perspective, Anne-Sophie. Frédéric, would you care to respond?
Yes. Sorry, on what was the, because I was answering.
No obligation, but in terms of remunerating patients for their involvement in the
yeah,
participation.
that's a good question. For us, it's very difficult because deciding who are you remunerating and why, it's complicated. it's true that we are trying to do that in other ways. For example, we did incorporate some of the most engaged citizens in the case of Galicia in the northwest of Spain as co-authors in a paper that came out. So we asked them to whether they want to be non-anonymous, because everything we do is anonymized, so we can connect to the cell phone, but we don't know who are the people. So that's something that we can do. We also planned, but we have not done this a lot, to make webinar seminars and make people have participation in other ways, not only collecting data. And for those people that really are coming to these other events, give them something, I don't know, a badge, something very simple. But it's something that for us it's not something that now it's on our route, really. The remuneration is very different from the case of Anne. But we want to, it's true that there's a lot of difference. There's citizens that participate a lot, others that don't, and this is always the case in citizen science projects. And for those who really participate a lot and are long-standing, we'll start to have need to have some thinking on how to reward them. Yeah.
Thank you for that. Well, the time goes by so fast and 1 hour just zooms by. So we only have time now for one more question before we have to start wrapping up. And so I wanted, from a participant, thank you, Huda Anan, you ask, how can you differentiate the difference in reporting on the mosquitoes? Some places would have more interest to download the app and report. Other areas, people will not be as interested. This would create a reporting bias, question mark. So I think this is for you, Frederick. Can you
Yes.
share more on this?
Yes. Of course, for the early warning tool, this is fine, because this is just, you want to observe a specimen in a given place and that's it. For the modeling purposes, of course, this reporting has biases. For example, we have most of the mosquitoes in urban areas, because that's where more people can report easily, for example, no? But this is just one type of bias. But if you see the last work that we have been doing for the last 10 years, we are now knowing how to get rid of the bias with statistical methods, and that's what we do. So we model the data. This data is not representative of the actual presence of the mosquito. You need to model the data. And for that, you have ways to get rid of these biases, introduce covariates like weather, temperature, land covers, and validate your model with other types of data. For example, we use trap data to validate our citizen science-based models. But this is all research, is from the academic side. That's what I know how to do, and I know it's just something that has not to do with the citizen. It's just from the science we can then inform stakeholders with reliable estimates. Yeah, we can do that. I cannot explain now. We don't have the time, but we know that and we deal with that. Yeah.
Thank you. Thank you very much for that. That's reassuring. Glad that you take that into account. Okay, well, before I hand it back over to John to close our session for today, I just want to take a look one last time at our Slido poll results. And what we're hearing from you all is that the most effective way you think to promote community participation in citizen science is through social networks, feedback, social media presence, feeling engaged, raising awareness, and empowerment, and easy access. So thank you all for sharing your thoughts. We also want you to share your thoughts in terms of what you want to see from future events from ECDC Lighthouse. So we're going to put up a feedback form for you. Just if you could kindly take 2 minutes. Many of you are researchers, you understand the importance of data, and the only way to collect data is to hear from you. So please do take a moment to provide your feedback, and we'll keep the survey open for a while. So if you don't have time right now, bookmark it, come back to it, and share your thoughts in more detail later on. But we do adapt what we offer in terms of events and activities based on your feedback. So it's very important to us. Okay, so with that, I'm going to thank once again our presenters and hand it back over to John.
Thank you very much, Alexis, and thank you so much for inspiring really, really comprehensive presentations and discussion. As usual, you just feel like this is just the beginning, and we're just opening the door to such a rich topic. I think what I really appreciate with Anne-Sophie is you gave us a really lovely conceptual overview of what this issue is all about. And I think for all of us who aren't in the field closely, that's incredibly helpful to get that oversight. And Frederick, obviously the mosquito alert app and the efforts that you're making there is really inspiring. It's a great example of how you can use this process, and much appreciated. And I'm so happy about the story you told about the tiger mosquito in Galicia. That's just a real success story, and really inspiring and exciting. And that's the kind of thing that we want to be hearing about, that can actually have significant public health benefits. I thought that the last Slido that we had was really interesting, the word cloud, because what we wanted to know was, what do you think would promote community participation? And my first question was, I was almost a little bit provocative there when I was asking about remuneration, but this is something I've been thinking about. But what came up on the screen were very human things to do with engagement and to do with communication and empowerment and being part of a social network. And that's somehow very sort of encouraging, and it's this is the sort of thing I think we can be really leaning on to bring this forward. Obviously, we need to take into account the expertise that patients give, and that needs to be taken seriously, and proper discussions need to be had on that. But this is a human process, and I think we need to see it on that basis. Finally, Frederick, while you were talking, I couldn't stop myself. I actually downloaded the app, and I'm now going to do this thing, because Sweden, you may not realize it, but in Sweden we have very many mosquitoes, you can say. It's a beautiful country, and you can have a lovely time in the summertime, and then the mosquitoes are simply unbelievable, along with many other insects. So I will be participating here. Luckily, we are concerned with nuisance at the moment rather than disease, but don't worry, I'll be participating. I did notice you don't have anything on ticks, and we do have actually a tick issue. We have TBE. That's something which we really do need to be looking out for, which is spreading here. So maybe you might want to consider including that one in future. Anyway, thanks to you both very, very much for your wonderful insights and for your expertise and for sharing your time with us. Thank you to all the participants for being with us today. We are going to have more webinars. We've got another webinar coming up next month on AI, which I think is going to be fantastically interesting. For members of the Lighthouse, we have a wonderful sounding spotlight event at the beginning of November about metaphors and antimicrobial resistance. So please keep your eyes open for that one. In the meantime, the discussion will continue. The questions that we've had here, we will continue this discussion within the Lighthouse for those who are members. And stay tuned, more good things are coming. And thank you for joining. Have a really lovely afternoon.